Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, welcome to Redefining Medicine. And today we have two really important guests, Dr. Tieraona Low Dog and Dr. Jeffrey Gladd. So it was a lot easier to say Gladd.
You nailed
and
it.
Low Dog
You
was
nailed them
actually
both.
easy.
Yeah. You nailed them both.
Anyway, they're going to speak tonight at the Longevity Fest in Las Vegas 2023, the biggest one yet for A4M. So we're really excited to hear about what they have to tell us. So thank you so much for joining us before your speech.
Yeah, it's great to be here.
Thank you for the invitation.
Oh my God, it's such a pleasure. And now that I know who you are, I understand so much more.
There you go.
So tell what you think. The audience is the membership usually, and whoever actually is interested in watching.
Yeah.
And so tell us about improving healthcare providers' tools. How do you do it?
Yeah, so Fullscript is a digital health platform that allows practitioners to prescribe, dispense, and manage the highest quality supplements in the industry. So we are very focused on the user experience and the workflow of the practitioner and not adding burden while still allowing them to create clinically valid plans to increase their patients' health outcomes, engage their patients on behalf of the practitioner who's making the treatment plans, and potentially grow revenue for the practice.
Yeah.
So you have about how many practices now?
Practitioners?
We're close to 100,000 practitioners
Which is
and have
amazing.
served
So
5.5 million patients.
You're serving a very much needed part of the healthcare, which the healthcare system that doesn't work.
Yeah.
But you're making it work.
Well, yeah. And, I think that, dietary supplements play a huge role in people's health today.
I agree.
It just does. And our patients are looking everywhere for them.
Right.
Whatever influencer is out there, whatever was out on Instagram, whatever's popular on Amazon. The problem with that is, one, that unless we're going to teach clinicians better how to talk to patients about even basic things like a probiotic or testing for vitamin D and how to take, we're talking very basics here. Many doctors still are very uncomfortable with that. They're unfamiliar with it because they didn't learn about it adequately in medical school. Well,
They didn't learn in medical school, period.
They didn't
know
learn.
adequately. They never teach them.
They didn't learn.
Of course.
So
of course.
it's kind of understandable that many just everyday people are going to go try to figure out how to optimize their health. That's why we're so happy to be here at A4M. We're happy to work with all of the educational programs that work to teach clinicians how to do their job better, and we're here to help provide them with the tools that they need. For instance, I don't want to have to look at a supplement and then try to figure out, is that a good brand? Have they got quality testing? Is that safe for me to recommend to my patient? So if I can start with a baseline at Fullscript that I know that every single brand that's sold there has already been through that quality testing, it makes it that much easier for me as a clinician. I can just get right to what do I need to recommend. And then I can find the products that are on there, and I can take away the whole burden of trying to figure out, is this a high quality product?
Right.
And that's huge.
It's huge. And the other thing that's huge is that what you were saying before, that, we're bombarded with Instagram, with somebody selling a product, with my friend's taking the supplement, this one's taking that. And, like we have patients from Europe, I was telling you about, from all over the world, and they'll send you the product, and you read the label, and they'll fill the table like this with supplements. And it's really hard to actually answer the question. And I think that your services are so important. It's really amazing because we need it.
Yeah.
And the doctors don't know anything.
Yeah, but even building on that, some of the things we're building and doing.
Yeah, so I mean, we have been very proud of our platform. Practitioners love our platform, but we know there's more we can do with what we have from a data perspective and an automation perspective to give better tools to practitioners. So to your point, rather than having the patient, send you pictures or they pull out of their wallet the index card with the handwritten supplements, you still don't really know what they're taking. So we have, current supplements is a tool that's coming to Fullscript in 2024, where the practitioner is going to invite and request the patient to build the plan of what they're taking today. Right? Take pictures of the bottles.
Yes.
We're going to read. We're going to scan the bottle, pull all the ingredients in. Whether it comes from Fullscript or not, there's going to be the 80,000 NIH database of products. And then the practitioner goes to Fullscript and sees the ingredient list of everything they're taking, the doses, the forms, the different products. And so that patient, I've had so many aha moments from patients when you just start talking about quality. You pick up that bottle and you show them what they're taking is probably contributing to some of their symptoms.
Of course.
Now that's right in your Fullscript, and now we can have this conversation of, hey doc, what should I take? Now the patient is engaged in the quality story of what is the best supplement for me to help me with what I need.
Right, and the doctors right now really don't have that information.
No.
That's the problem.
No.
The biggest problem.
Yes.
And it's, let's just face it, when somebody comes in with the garbage bag full of all their supplements and you're trying to write them down or you're trying to scan them very quickly because you don't have 2 hours to sit and to do this, the ability to have them take a photo and then be able to link that to the national label database that has 80,000 supplements. So when they see the picture, it'll just pull it up and it'll list all the ingredients. One step further will be that when all those supplements are put on there, all the ingredients will be tallied. So maybe they thought they were getting 1 magnesium, but they're actually got magnesium in 6 different supplements, and now we'll see just what their total is, and maybe that's why they've got their diarrhea.
Yeah, no
right?
kidding.
Right.
And everybody taking 4,000 types of Bs.
Exactly.
And then
Nailed it.
wondering how come their B12 level is 2,000 or
Exactly.
3,000.
It's off the chart.
And and those are things that people don't know. And
We're gonna make that easy.
Which is amazing. You guys are absolutely at the right time in the right place.
Yes.
Yep.
And it's important, and I think we need to teach the practitioners, those who are learning about how to do it, because we do need help.
Yeah.
Yeah.
Well, that's part of it, is education. Also, Fullscript's very committed to education. So there's online CE, continuing medical education. There's like dietary supplements 101 for people that are just starting. There's classes on supplement quality and sort of giving you tips and strategy on that. But more than that, one of the things that I love are all the protocols that they have, which you can customize. So they have a, protocol for, constipation, for example. Well, I can.
Magnesium.
Is there any other way? I mean, it's like, who needs a laxative when you need mag?
Of course.
But
What were we doing with the laxative?
it would have, great question. But then you can customize that protocol if you want. Maybe it's an IBS with constipation, you want a probiotic, et cetera. So the protocols are all based on evidence. They're all summarized, but they allow you to customize them based on what your patient needs. But let me just tell you, as a practitioner, I don't want to have to write every treatment plan out. I like being able to go and find protocols that are already there. Sometimes I'm learning things. I'm like, wow, I never thought of that. That's interesting. And other times I'm like, oh, I'm not sure I want that. And then I can just customize it, send it to the patient, and the patient can take the supplements and they have my treatment plan. So I'd say Fullscript is not just about fulfillment of supplements, of the highest quality supplements. It provides tools for practitioners to be able to more seamlessly be able to provide integrative and functional care to their patients. Because, we're going to lose 1 in 5 practitioners. They said they're going to leave medicine. They're just leaving because they're
because
tired
they're
of
burned out.
burned
because
out,
nobody's teaching
administration,
them anything.
all the things that they really need that gives them joy and satisfaction in their
And
practice.
they went in there to heal,
They
to
did.
help.
They went in to
And
be
then
healers.
you forget
went in-
about that.
They
Right.
went in to be a
Yeah,
healer.
isn't it unbelievable? Yeah,
Yeah.
no, you guys are amazing. Tell me
Yeah.
more.
So, one of the other new features that we're excited about is, when you're writing a treatment plan,
Right.
we've asked practitioners, what does it mean to write the optimal treatment plan? Again, you've understood the dose, you've understood the form, great. You've found a product on Fullscript. What does it mean to choose the best product? So now again, bringing in data and automation, have a comparison page that allows you to compare products, same dose, same form, but this one has less pills. So the patient's more likely
Beautiful.
to stay on it.
Yes,
This
Yes.
one is a powder and your patient doesn't want to swallow capsules.
beautiful.
This one is lowest cost or has the highest repurchase rate by patients, which probably means it's best tolerated, it's a smaller capsule,
Yep.
and so patients are staying on this longer. So optimizing your workflow in an automated way is exactly what we're trying to kind of continue to enhance and not just be a shopping cart for supplements, but be a treatment planning tool for practitioners.
Right.
Sounds amazing.
Right.
Yeah.
Sounds amazing. Sounds like a dream come true, for sure.
Well, because we do, when I go on and I'm going to look for NAC or I'm going to look for something, I don't want to have to scour through every different brand to
Of
figure out
NAC,
what I
of
want.
course.
I like to be able to look at it and then sort of say, oh, look how much dose is in this capsule.
Right.
It makes it a lot easier.
No, a lot easier.
Yeah.
And then people will still go to Amazon or will still order something on IG because they're promoting some new thing.
Yeah.
And then, though, with your help, it makes it less likely that that would become a norm.
That's right. Yeah. No, it is, it starts with having the quality discussion with your patient
Yes.
and
Right.
why choosing quality
Right.
is of utmost importance.
And the patient actually knowing that you, the doctor,
Yes.
know something about
Yes.
That's it.
supplements,
Yes.
which most of them assume that, that you don't
That
know
you don't.
anything about.
Right. Correct.
Yes.
And so, now you've told the quality story, you've got the patient bought in. To your point, they can still go find this online. And some of these brands that we advocate for and have on the catalog are out there. But they're also locked at MSRP pricing.
Right.
And so Fullscript gives the practitioner the ability to discount for the patient the highest quality supplements. You're
And
talking
also
about
you
best
send
quality.
more than one. I mean, you would send the 10 supplements yourself.
Right.
Correct.
Right?
That's right.
As opposed to them ordering from one place,
Here
or one
and
place,
another.
or one place, right.
I do think it's important, though, for clinicians to be very aware of the problems that we're still seeing on Amazon, though,
Yeah.
and they're very real. I mean, we had the JAMA article that wasn't out that long ago. They took 30 immune supplements. I mean, 9 of them, so think about that, almost a third of these products actually contained ingredients that were not declared anywhere on the
Yeah.
label, that didn't have
Yeah.
anything on what was on the label. You had another 10 that, didn't make their label claims. And we also see branded products. A branded product, there was 2 large brands, very large brands, who patients or customers complained to them that the tablets seemed different than what they had been ordering. And so when they asked for the bottles to be sent, it looked very much like the company's label, but of course the batch numbers on the back didn't match any of their batch numbers. They notified Amazon immediately, but the counterfeits have been very difficult to catch. They look very similar to the
Yeah.
branded products.
True.
People are so clever at doing this. I know it's
That's
horrible.
horrible.
It is horrible. But so even going online and looking for branded products on Amazon where it even looks like it, we're finding is really problematic. So, and we're not going to stop people from ordering stuff on Amazon, but if I could get them to stop ordering supplements on Amazon,
Well, if
we'd
you
be
get
way
them
ahead
to
of the
actually
game.
start listening to their doctors, who actually understand, are working with you,
Yeah.
then we have a prayer.
We
Literally.
do.
Yeah.
We do.
Literally.
We do.
Yeah.
Well, and that's education, right?
Yeah,
so
it's
so
all
teaching
about
the practitioner, but also having the practitioner have that relationship with the patient and
Always.
educate them
Right.
on that importance.
Right.
But it's also another value add of Fullscript is all of those resources and educational assets.
Right.
They're also in the platform.
Right.
All
So
right
as
there.
you prescribe your
Sounds
high quality
amazing.
treatment plans, attach the education that supports why this is so important. That's all there for the practitioner too.
And they need it because
Yes.
they're not getting it anywhere else.
You've got some, Fullscript has some very nice patient handouts too, though. I used some just recently on the probiotics, and I thought, that's really nicely done. It's very pretty. It's got nice graphics. I didn't have to write anything out. I don't have to go look for a handout on probiotics. We spend so much time on administrative work in clinic, just so much time on administrative things. And anything we can do to help streamline that so the patients have the resources that they need and the providers have the resources that they need to be able to provide that to the patient is a win-win for everybody.
Well, we go back to healing.
Yeah, we have more time to be doctors and less as administrators and shopkeepers and everything else.
Exactly.
I used to always stock all my own, supplements in my office because that was the way we did it.
I remember that.
We just stocked it all.
20 years ago, we did
Yes,
it right.
everybody
Yes.
we stocked it, and
Yes.
so today it's so much nicer to be able to and it's nicer for my patients to be able just to get it delivered to their home,
course.
and then they can set up on auto ship, and I'm notified also when they're getting their next order, et cetera. So. I'm thrilled with Fullscript. I think it's making lives for practitioners and patients
Whose
so
idea
much
was
better.
it? Where did it come from?
Whose idea? So Kyle Bratz is he's our co-founder and our CEO. He and two close friends had this sort of vision of, one of the friends' wives is a naturopathic doctor in Canada. And basically they saw the pain points that Tieraona was just pointing out, right? Having to carry all this inventory or sending patients out into this world
Yes.
of I have no idea what to
Right.
buy. And so they were in technology, they were really into user experience, and they married that need and their skill set. And basically that's what Fullscript was. That's how it was born. And we just continue to iterate with a big team of, technology people and design people and product people
How
who
big
just
a team do you have?
we have 800 at
Amazing.
Fullscript. Yeah,
Amazing.
800. So
Where is it headquartered?
headquarters is Ottawa, Canada, but then we have hub locations in New Hampshire, Arizona, Boston, and 5 distribution centers across the United States, which allows the products
Yes.
to get to the patient
Quick.
in 1 or 2 days, right?
Quick.
Really important on
Yeah.
that competitive side.
Amazing.
Yeah.
Yeah.
I love it.
I can order, and I live out in the
That's a big deal.
boondocks. I live out in the boondocks in northern New Mexico, but I can get my product within 2 days. It's just
Beautiful.
and it's got, freezer bags in it to help keep it cool in the summer when it's hot outside. And I mean, just first rate. And, but the education piece is so interesting because I'm very sensitive to the fact that when you send a patient out, you tell them to go get these things, they may go to Amazon, but they may go down to the local natural
Right.
grocery store or other
Yeah,
things.
they do.
So when I was at the University of Arizona, I ran that fellowship program, Fellowship in Integrative Medicine.
Been on that trip.
And I would take them to Sprouts. And I gave them these little cards and said, okay, so this is how much money you have, and this is your patient's problems. Go find their supplements. And you guys were like a year into the program already, and they're standing there. And for many of the docs, not Dr. Gladd, of course, but for many of the docs there, they'd never really gone to a health food store.
Right.
And they didn't shop at a natural grocery store. So when they were there and they were like, oh yeah, I need a probiotic, and I'm like, well, which one? And there's like 40. And they're looking at it and they're going, and they're picking them up and they're not sure.
Yeah.
And then they were like, well, we're going to give an herbal supplement. And they're thinking of the herb, and then they're going over there and there's 20 different echinaceas with
course.
leaf and fresh leaf and root and leaf parts. And they're just like overwhelmed. And the reason I took them was because I told them, if you're this overwhelmed,
Can you imagine the patient?
how dare
Exactly.
you send your
Right.
patient
Exactly.
out to try to
Exactly.
figure this out
Can you
on their
imagine?
own?
Oh,
Exactly. That's why I love what Fullscript is doing, because it's taking all of that guesswork out. It's guiding new practitioners that are kind of new at this and they're just learning and they're wanting to help their patients. We've got all kinds of tools for them, but also for the very seasoned practitioner who really knows what they want. A lot of great tools, easy, seamless. I can write a prescription, new prescription, really easy for my patients. It's a very nice. You're going to be a Fullscripter before long, I can
Well,
tell
you
you.
told me that at the end of it. Well, thank you so much, guys. It was such a
Thank you
pleasure.
very much.
You're a
That was
delight.
excellent. That was excellent.